they give rise to nasal pit. This is the nasal pit. Okay. Later on, it become bigger. The nasal pit become bigger. It give rise to medial and lateral nasal process, and now it form nasal sac. This is the nasal sac. The nasal sac that is separated from the stomatodium by bucconasal membrane. This is the bucconasal membrane. Now you see here, these are the nasal sac. This is the frontonasal process. Once frontonasal process become smaller, the nasal sac, the nasal cavity that become bigger. Nasal cavity become bigger. So the nasal septum develop from the frontonasal process. Nasal cavity develop from the nasal pit. This is the nasal pit, and this is the bucconasal membrane that separate the nasal cavity from your oral cavity. Later on, it disappear. So you have to remember the diagram, and with the diagram you can explain it. Now paranasal sinuses, how the paranasal sinuses develop. The paranasal sinuses are the air containing spaces of the skull, within the skull. Those open into the lateral wall of the nose. So they develop as a diverticula. Diverticula means extension of the cavity. So they develop as a diverticula of nasal cavity. So from nasal cavity, there extend the cavity, the diverticula. So what happened? The megaly sinus, that is the largest sinus, and anterior and posterior ethmoidal air sinuses, they develop during fetal life. So during fetal life, only frontal sinus, anterior and posterior ethmoidal sinuses, they develop. The sphenoidal sinus and frontal sinus, they develop after the birth. Okay, before birth they do not develop. So frontal sinus and sphenoidal sinus, they develop after the birth. Megaly sinus and ethmoidal sinuses, they develop before the birth. These sinuses are extension of the nasal cavity, diverticula from the main nasal cavity. This is the development of paranasal sinuses. So once again you see same thing is repeated here. Face develop from megaly process, mandibular process, frontonasal process. Okay, this is how the face develop. Now megaly prominence, that give rise to the upper cheek also, the upper cheek region. Okay, upper lip, maxilla, zygomatic bone, and palate, a part of secondary palate, that also we'll discuss. All they develop from the maxillary process. Mandibular process, that give rise to the lower jaw, gum, and lower cheek, this lower your lips. Now palate, how the palate develop? Palate development is known as palatogenesis. So for the development of palate, you see there are two maxillary processes. Once again, maxillary process develop from the first arch, from the mandibular arch. There arises a process, that is maxillary process. Now maxillary process give rise to development of two more palatal processes. The maxillary process, that give rise to the two palatal processes. So two palatal processes fuse together to form the palate. But the anterior part of palate, okay, this is the premaxilla, this part of the palate, that develop from the frontonasal process. So you have, this is known as philtrum of the lip. So this maxillary process also give rise to, this is philtrum of the lip. Now premaxillary part of the maxilla, that bear the four incisor, this is the incisor teeth, and the gum. Okay, so now what happened? Two maxillary processes give rise to the palatal processes. So two palatal processes fuse together. The anterior part that develop from the frontonasal process, all the part fuse together, they give rise to the palate. Now later on ossification take place. So anterior part of the palate, there is ossification. So anterior part become hard palate. Posterior part of the palate, it do not have ossification, so it remain as a soft palate. This is the how in the 5th week it starts palate formation. At the 12th week it is completed. Okay, the palate. So we have primary palate and secondary palate. Now primary palate, as I told you, in the 6th week from the intermaxillary segment. Okay, this one, median palatine process, this one, from frontonasal process. This is the secondary palate from the two maxillary processes, which give rise to palatal processes. Now you see, this is the hard palate. This is the hard palate. Due to ossification, it become hard, and posterior ossification is not there, it remains soft. So that is the soft palate. This is the development of palate. So the palate, posteriorly you have development from the palatal processes, which are the part of maxillary process. So this is the diagram by which you can draw. This is the nasal sac, This is the primitive palate. Okay. Now you see nasal sac. This is the palate. Now with this diagram, you can explain. This is a very easy diagram. Okay. These are the nasal sac. This is frontonasal process. Now they give rise to this frontonasal process, give rise to the primitive palate. Now you see the very easy diagram. These are the Meghly process. They give rise to the two palatal processes. And these two palatal processes fuse together to give rise the palate. So these are the two palatal processes. You see palatal processes coming from the Meghly process. Now finally, this is the how formation of palate take place. So you need not to study what detail I'm showing this one. You study only this one. This remains soft palate. This become hard palate. So as I told you, this is primitive palate. Okay, primitive palate that developed from frontonasal process. This is the palate from the Meghly process, and posterior part remain unossified. No ossification take place, so it become soft palate. Now we come to the anomalies. What are the congenital anomalies? Malformation of face, nose, and palate. So we have cleft. Cleft means gap. Failure of fusion of any process, whether it is a palatal process, Meghly process, or mandibular process, can give rise to the cleft of the facial region. So there may be only lips cleft, that is a cleft lip. There can be cleft palate. There can be both cleft lip and cleft palate, and there can be oblique facial cleft. Now here you see this is unilateral cleft palate. So failure of fusion of palatal process on one side can give rise to unilateral. This is bilateral. It is failure of fusion of Meghly process with the medial nasal prominence. So this is bilateral cleft palate. Now you see oblique facial cleft. This is oblique facial cleft. Failure of fusion of Meghly process with the lateral nasal process can give rise to the oblique facial this cleft. Now this is cleft palate. Failure of fusion of palatal processes can give rise to the cleft palate. So cleft palate is a common anomaly. The baby is born with this gap in the palate and sometimes gap in the lip also. So baby who are born with this anomaly, they will be having difficulty in sucking the milk. Then they will be having recurrent attack of upper respiratory tract infection. So these cases are treated with the surgery, okay, with the plastic surgery. So with 2 or 3 steps are there. Within that step, at a different ages, these anomalies can be treated with the surgery only. Now, variety of hair lip. This is the median cleft lip. Okay, this is the bilateral cleft lip. This is the upper lip cleft. This is the lower lip cleft. So cleft means gap. Now, other than that, you see the oblique facial cleft. There is very, very rare and very interesting anomalies there. That is proboscis. When the nose comes out from forehead, you see, proboscis is an anomaly. When the nose is jutting out, okay, nose is jutting out from the forehead, that anomaly is known as proboscis. And some baby are born with single median eye, that is known as cyclops. This is a cyclops. Single median eye, sometimes fused eye in the middle of the forehead. That anomaly is there in anatomy department of our college. I got one Peter, still it is there if you go and see. So fused median eye in the forehead is there. So these are known as cyclops. These babies do not survive for a longer time. They die after some time. So these are again the same cleft, what I told you, median cleft, single, unilateral, bilateral. So clefts are gap, failure of fusion. These are the cleft palate, various cleft palates are there. Other anomaly. Other anomalies, we have Treacher-Collins syndrome, we have retronathia, anathia, hypertelorism. I'll show you with the picture. See, this is hemifacial microsomia. So one side of the face could not develop completely. So that is hemifacial microsomia. One side of the face and mouth is smaller than the normal. Then Treacher-Collins syndrome, this is mandibulofacial anomaly. Okay, failure of development of the mandibular and Meghly process can lead to this type of the anomaly. This is first arch anomaly, teacher calling syndrome. Now, micronathia, this one, smaller lower jaw, smaller this chin, it is known as micronathia. This is micronathia. Now, here you see hypertelorism and microsomia. Hypertelorism, the medial canthi are far apart. Normally, when you see there is a little gap between the medial canthi of the eye, medial angle of the eye. So when the baby is born and there is a long gap between the two medial canthi or two medial angle of the eye, this is known as hypertelorism. Hypertelorism. So same anomalies, cleft lip with the cleft palate. So this is unilateral cleft of the upper lip, bilateral cleft upper lip. This is the upper lip cleft with the cleft palate. This is only cleft palate, and this is oblique facial cleft. So these can be asked as a very short note question. No major question will come from the embryo. So you should not be worried about